Aaron.
Hi, hey Sebastian.
Hey man, how's it going?
Good. How are you?
Good. I should get some speakers in. Shit.
Yeah, I mean, you can hear feedback, right? Because I have speakers on right now.
You sound good.
Oh, okay.
But I don't, and I just realized that. How you been?
Crazy, exciting, scary. Those are, I don't even know what to say. Yeah.
That's awesome.
I appreciate it.
Hi, Eric.
Hey guys, how are you?
Hi, good.
Hi, Deb.
Hey, I made it. Thanks for joining. So, Sebastian, I got questions to ask from Aaron and Eric, but I didn't get any questions from you.
All right.
But I think the questions from Aaron and Eric are relevant to everyone. And this is going to be casual. I want it to be about you guys and the good work you're doing. And Aaron, I am in the office, but I made the exception to not wear my mask, even though it would be great for you.
Totally get it.
Whenever I wear this, and I wear it all the time, I usually sell about 2 or 3 of them for you. So
yeah, I've actually stopped wearing it out in public just because I can't get anything done outside if I wear it around.
I only go to the grocery store.
Yeah.
I only go to the grocery store, so I wear it at Eddie's and Whole Foods, and I sell at least one every time. So
awesome.
Yeah.
Thank you.
Deb, do you want me to quickly send you a couple questions, or just
can.
not?
It's as I said, I want to keep this really casual, and in fact, I'll say that when we start. Hang on one second. Celine, are you letting people in?
Everybody's in. You're live.
Oh, we're live. Yikes. So here we have been talking with each other, and we're live.
We know it'll be casual, so it is casual.
Yeah, it's casual now. At least I didn't say the part about this was a good excuse to take a shower.
Yeah.
Okay, so we are live. Thank you, guys. This is my opportunity to have you showcase the great work that you guys are doing and have done. And I want to thank you all for having some part of being at ETC. Aaron and ClearMask, you went through our accelerator. Sebastian, you were in our co-working, and Eric, you were in our incubator. So you covered all the bases, and I thank you very much. With that, let's start at the top because, I'll go in clockwise. But Aaron, introduce yourself, what the name of your company is, and anything else that you particularly want to say.
Sure. Hi, everyone. My name's Aaron Sue. I'm the CEO and co-founder of the ClearMask, and we made the first fully transparent surgical mask in the world, and we received FDA approval.
And I will show you.
April 5th of this year, which was great timing, and have been scaling at an incredible pace since then.
Thank you, Aaron. Sebastian?
Yes, I'm Sebastian Sager. I'm the CEO of Emoca Mobile Health. We use video technology and human engagement to help people take all their medication. And for COVID, we actually reanimated a symptoms monitoring program that we had started back in the Ebola days for the state of Maryland. So it's been a lot of fun to meet a lot of new customers and make new friends through that.
Great. And Eric?
Yes, I'm Eric Hamrock, so I'm the co-founder of Stochastic. We're a digital health company, so mainly focused on triage and using electronic health data to provide decision support for clinicians and caregivers.
Great. Thank you all. Before I go any farther, even though it is all about you guys and the good work you're doing, I have got to say that without Celine Monroe, without Celine, none of this would be possible. So big shout out to Celine for making this possible, for organizing the whole day. And it couldn't happen without her. She came in early this morning and was sweating, just so nervous that technically something was going to happen. And I know it will before the day is out, but you know, so far so good. And yeah, it was really tough to follow Andy and Dan, but we'll try. With that, I'm going to ask a few questions, and actually even some of the ones that Eric and Aaron sent will register with all of you. And so in turn, I think the one that is best, and Aaron, you can start, is who have your customers been, in what areas, and why are they using you or agreeing to work with you?
Yeah, I think the obvious one that everyone thinks of first is obviously healthcare. And we were fortunate to be able to help fulfill a lot of the gaps in PPE right when COVID was starting, because the main bottleneck for surgical masks in particular was raw material. A lot of the N95s and surgical masks use the same materials, and the raw material was actually what was causing most people to not be able to produce surgical masks. And we actually used completely different materials than standard masks, so we were able to get our supply chain up and running pretty quickly. So our first major customers were state agencies, federal agencies, and healthcare organizations. The state of Maryland was actually one of our first bulk customers, along with obviously the New York City government and a lot of the Veterans Administration organizations. And then outside of that, a lot of—
Aaron, you might want to up your audio a little bit.
Okay.
Up your audio a little bit.
All right. A lot of schools, can you guys hear me better now?
Much better, thank you.
Okay. Yeah, a lot of schools, especially I think when people were trying to decide if they were going to go back to in-person learning, a lot of younger elementary to middle school, even some preschools, because I think a lot of people realized how important it was for children to see faces and facial expressions and how that contributed to their development. And then some of the more, I guess, outside of the box ones that we didn't think about was dementia patients. A lot of hospitals, specifically kind of older care homes or end-of-life kind of facilities, started reaching out specifically for their patients. So that was something that we didn't think about or thought of as a target market that kind of popped out at us.
But Aaron, quickly, and then I'll pass it on to Sebastian, but give us just a short summary of your origin story.
Sure.
Why Clear Mask?
Yeah, so we started back in 2017. So we predated COVID for a bit. And we started because one of our co-founders, Alyssa, is deaf. And because she's deaf, she requested a sign language interpreter for a pretty major surgery she was having. And unfortunately, the interpreter never showed up, which is pretty common. And she was able to get by lip reading in pre-op. But once she got into the operating room, all of the doctors and nurses were wearing surgical masks. So she was completely cut off from communicating with anyone around her. And they were trying to ask their final patient safety questions that are mandated, like, who are you? Do we have the right person? Which side are we operating on? What drugs are you allergic to? What's your blood type? They were trying to put in their IVs, blood pressure cuffs, position her, all of these things, and eventually just stopped trying to communicate and treated her like a doll. It was a very inhuman experience for her. And when she told me that story, I thought, well, why don't we buy a transparent mask so that next time, at least you can lip read. We went to go online and look it up and realized no one had made one yet. And that was kind of the first step in, there's obviously a need for this, and it may be niche, but it's something that no one should ever go through again. So we have the ability to make that change. And why don't we? and that was kind of the start of ClearMask.
Great, thank you. And isn't that just the very essence of why we're all here today? Innovation, right?
Right.
Something as what appears to be simple as that, and yet it takes, an aha moment to really move forward. So thank you, Aaron. Sebastian, along the same lines, your customers and why have they come around, and maybe even what's a little different with COVID?
Sure. So first of all, Aaron's founder story is probably one of the best I've ever heard. And I also am just so happy for him and ClearMask to be, this is a great positive out of the pandemic, that, an entrepreneur can get a break like that and be helpful to pretty much every single person on the planet, in theory, right? What a market. Anyway, for Emoca, we help patients remotely take medication and monitor them remotely. So it's not a big stretch. And we were founded in 2014 at Baltimore City Health Department for patients with tuberculosis. It wasn't a big stretch for the state of Maryland to say, well, could you use this technology for people traveling from Africa who might have contracted Ebola? So the idea that you would monitor somebody remotely for symptoms, for side effects, et cetera, was not unusual and not a big stretch. And when we pulled that off in 2015, 2016, then the Hopkins Biocontainment Unit asked us to monitor healthcare workers for similar disease states. So we'd been running this, it was a software since 2016 at Hopkins. And so when COVID started, what we realized was that the scope was so big that the software would not be enough. And we have a services team that when providers are too busy to monitor their patients and their medication regimens, our team does that engagement and does that monitoring. So our services team stepped up, and we launched not only a symptoms monitoring program and software, but a full engagement service to solve all problems that happen on a given day. And close the loop that day. So that the customers are the same as Aaron mentioned. So schools, municipalities, employers. We do have a couple retirement homes as well. And then we also have really interesting customers like a health payer in Nevada, the Teachers Health Trust, where we're going to monitor all teachers in Nevada. But at the same time, they're very interested in helping those same teachers with disease management. So it's been a very interesting time and a great chance to expand the product.
Great. Eric, I promise next time you'll go first with the question, so you don't have to sit there.
No, these are tough acts to follow. So yeah, very great work.
But your customers and why they continue to support you, and if you want to talk a little bit about the changes that have happened as a result of COVID.
Yeah, absolutely. So again, we're a digital health company. So we spun out of Johns Hopkins in really 2016. And our clientele is really hospitals. We work with some clinics and more community-based areas. But pre-COVID, we were really focused on emergency departments, which was kind of ground zero. Part of the problem with that, though, was that emergency volumes, everybody was kind of bracing for this huge, influx of patients, and it really never happened. So basically, EDs saw about a 40% drop in volume. For us to go out and to try to, distract those clients and to try to sell into that or upsell services, it really wasn't going to be feasible. So fortunately, we had been working, one of our main clients is called OSF Healthcare. They're located in Peoria, Illinois, 14 hospitals throughout the state of Illinois. And they approached us about, looking at some opportunities to adapt in the community to try to keep patients out of the emergency department. So they got some funding through the state for what's called a pandemic health worker program. And those that aren't familiar, there are clinicians that are called community health workers that basically go out into the community, help patients with social determinants of health. Really are trying to get out ahead and see all those things that may not be collected in an electronic health record. So we were able to take really two of our solutions. One is called e-triage. The idea is that when a patient arrives at the emergency department, we take readily available data like vital signs, demographics, and we provide a risk score. And we also had a scheduling platform that we call eCaseLink that's implemented at Cleveland Clinic. And so we were able to really combine the two into one, an intake and triage solution. So when these patients were calling in to this telehealth program, we could provide them with some more clinical decision support to identify whether that patient needed to go to the ED or the hospital, or whether they were safe to stay home. Then we were able to really build a mini electronic health record where we were collecting all this data, social determinants of health, all the stuff that kind of wraps around patients that the traditional electronic health record doesn't have. And then on the back end, really allowing these mobile resources to be deployed. So it's a scheduling platform that we could optimize which pandemic health workers should go to which client or patient at which time. And so again, optimizing and trying to be more cost effective. So that's really where we were able to sit and we'll talk a little more about it, but been able to expand that out. And it was a great opportunity for us to pivot. We were able to also pick up another client. So we're pretty much right now covering most of the state of Illinois with our what's called Patient Sense.
Wow, Eric, that's great. This is one of the questions from you, but it was, how did you adapt to working both remotely and on this accelerated timeline? And I think that's relevant for all three of you, but take it first, Eric. Yeah,
sure. So again, we're a software company. Most of the work that we do has been mobile. So we kind of work in pods. So we have, I would say our team is broken up in about 2 or 3 pods where we would get together and work together. And so when the pandemic hit, it wasn't a complete shock to us to have to use things like Zoom or Teams and to be able to collaborate through those mechanisms. But I think what was difficult was we didn't have those core teams that we worked together where we could just turn around and collaborate and kind of get those organic conversations and things that might happen when you're in person. The other piece of it that you alluded to is that not only were we then separated and working on this, but the accelerated timeline was something that was, I think Andy and Dan spoke a little bit about. I mean, it was good because it kept our mind off of everything that was happening with the pandemic, and we had something to focus on, but we were really aggressively working towards these timelines. So we work in an agile environment, had multiple sprints, and then we were trying to work within our clients' environment who was also adapting. They were less virtual, and so fortunately we had Anthony D'Angelo, who is our product manager and really just is kind of a jack of all trades, really took the lead and was able to corral and focus our team as well as our clients' team. We were also fortunate to have a really strong project manager on OSF's side. So she was able to corral and make sure everybody on their side, was able to communicate with us. They went through a couple iterations of kind of project management, Jira, Asana, those types of things, but we were able to adapt into those for them. But I think the main thing was just really making sure we were coordinated. And, we stood this thing up in about 2 weeks.
Wow.
It was ready to get into the hands of the client and then went live with it in about 3.5. So typically in healthcare, for those that aren't familiar, it's a much slower moving industry. And so, that was something that we were ready for. We were always, waiting for these opportunities to deploy very quickly, but sometimes you have to be careful for what you wish for. So
yeah. Sebastian, wonder what's happening with my audio. That's weird. Sounds like I'm barking at you. Sebastian, why don't you pick up from there? How did you adapt to remote working and also this pretty sped up timeline?
Yeah, so part of the team was already remote working, a lot of the engineering side. At first, I mean, I could never have imagined a remote work environment, but it turned out that just to be frank, the brainstorming time just got condensed. So you just didn't have that opportunity to grab somebody and start, throwing stuff up on a whiteboard and, over analyzing, let's call it. So the decision-making process got much faster, which is a benefit. There was so much work that there was no like lack of productivity that you could point to just because of the fact that you're remote. Probably the opposite. People could concentrate, and the space to think was helpful. And then on the technology side, the release cycle just went out of control. I mean, it's probably like 2 to 3 software releases a week, as opposed to like once every 2 weeks. So in general, I would say we did very, very well remote, but we're also a very tight-knit team. And so it's just terrible to not see people every day. And because these are people that we really enjoy being together. But hey, it's worked out quite well thus far.
Good. Yeah, no, I know that feeling, wanting to be around people. Aaron, I'm going to leave it with you. And I think the thing that's really critically different from what Eric and Sebastian were saying, because they're in the software business and scaling, you have a hard product. You need a warehouse. You're in manufacturing. So tell me how that looks in this scaling time and also having to work remotely. You really can't.
Yeah,
very different.
That's exactly it. We really couldn't work remotely, and so we had to be really careful about safety when we were first starting out and scaling. And going back to what Sebastian said, we had a really tight-knit team that had worked together for 2 years and worked really well together. And everyone kind of knew their role, knew what they were responsible for, and knew what they needed to do to keep things moving forward. But we also relied heavily on our partners. So we had to scale our manufacturing from 0 to, we did a million masks a month in 3 weeks. And then in another month, we're up to 4 million.
Oh,
yeah.
That's amazing.
It wouldn't have been possible without Xometry. Our manufacturing partner was actually based in Maryland. And then we also had our shipping and logistics partner based in Baltimore. And so we've been able to keep everything within Baltimore and Maryland and utilize their skill sets, right? Because we didn't have the time to figure out a lot of things that we had to, such as, how big the box needs to be, how many masks can we fit in the box, what's the configuration, where do we get these boxes from, what's the weight, all these things that we had to figure out, and then quality management, manufacturing processes, assembly lines, hiring, things that we had to just trust our partners on and trust that, people wanted to help. And I think that was the major difference for us in our ability to scale, is that we trusted people, but also there was this kind of common goal of, this is important, right? This is a global public health issue. And the support that we had from everyone was incredible. People offering to do whatever they could to help for, any reason, for, just, we were inundated with offers to help. And that speaks
Aaron,
a lot.
Excuse me for a second. Am I correct in that the early days were, because I see Margie is here joining us, shout out to Harbor Designs, early days.
Yeah, in our initial design kind of iterations, Harbor Design helped us a lot with the CAD, the sourcing materials, kind of narrowing down what we wanted to do and what we didn't want to do. So yeah, definitely.
Great. Okay, let's move on. I've got another question here. I'll throw it out to Sebastian. Oh, this is interesting because I think it will be helpful to everyone, but have there been any lessons learned and takeaways relating to leading your team now that it's we're in this interesting position?
Well, the team's grown, so we're probably at about like 55 people right now. So many people do not carry the history of the company and intrinsically, whereas we had a core of 20-some people who had lived and breathed our mission, which is to help each patient take every dose of medication. So now you bring people in who are engaging with, let's say for the city of Columbus, patients who have been isolated because they were exposed to COVID, or they have COVID. And these people are team members who may not have all the original stories. So we've had to, do a lot of sessions where we bring in, let's say our founding infectious disease docs from Hopkins and tell the founding story and explain to people where the company was and where it's headed now, and try to fit these different worlds together, the pre-pandemic and the post-pandemic world. So I would say from a leadership point of view, that's been important. The other thing has been that the pace and the scaling creates natural tensions between different parts of the business. We try to keep the sales team and the engineering team friends.
Good luck with that.
Yeah, exactly. So it's been, but everybody appreciates what the other side's trying to do, but there are natural tensions here, speed and quality, revenue and product definition. And you walk the line and it works out in the end.
Right. Eric, I'm going to throw it to you because that was the question that you actually sent me. So lessons learned and leading your team.
Sure. Yeah. So again, I've been in healthcare for almost 20 years now and have led different teams. And I'll say that this was something that I've never experienced on such a long term. I mean, I used to work in nursing homes and long-term care, and we would have things like hurricanes or things that were, discrete that you could prepare for a couple of days. But this was something that I think was, very unique, obviously. For me, I think some of the lessons learned, it goes back to that not really having the day-to-day to make sure that people were okay. So you had something that people deal with things very differently. And so, I always want to treat others as I would want to be treated. And really, we're a smaller team. We have really 11 folks in our team. And it's cliche, but we're really a family. But, really trying to understand how people were doing with all that and dealing with that, as well as just the extreme, speed of the work. So I think that one of the things was just trying to really keep a beat on people. I mean, I did, go out and try to see people in person just to make sure that they were okay, tried to bring them some things that, might help them through, and, that kind of thing. So I think it's really about, the work is great and we all work, but it's really about how do we care about each other and kind of love one another. I think that the other thing of it is that we're fortunate to have a mission that we were actually able to help with the pandemic. And so I think as Sebastian said, really keeping people focused on, what is our mission? And we try to provide, high quality care to patients, help with savings and provide help to the caregivers that are giving that care. And so everything we did, I think that, that again, what Sebastian alluded to, that tension between kind of the client facing folks and the engineers, making sure that when requests were made and they were asked for in very, kind of compressed timelines, that people understood the importance of that. And it wasn't just that, well, this field needs to go here because it was, prettier or that kind of thing. It was something that was functionally, valuable to giving that patient care and to providing that care to those potential COVID patients. So, I think that again, it really came back to as being a leader. It's what we try to demonstrate all the time. And I admit I fail at, but try to really keep those lines of communication open, really being available to people and really, trying to be there for them if they're dealing with anything and making sure, again, that they're very clear on why we're here and what we're trying to do day to day, hour by hour. So.
Great, Eric, thank you. And I think one of the most important things you said was really caring about your people in these trying times. What are they going through at home? And we all know that there's difficulties at home, not just with looking out for children or a loved one or whatever else. But Erin, again, you're in a very different situation because you actually are going in, you're actually in person with your people. But what are you taking away, and lessons learned in these trying times that will be helpful for not just you, but others in the future?
Yeah, I think a big part of it, and it's a common theme that we've all talked about, is keeping communication open, but also making it very transparent and honest. There are times when you're going to have to disagree, or there are times when people see things a different way, and you want to build a culture where it's okay to disagree, but as long as or ask for help, or be vulnerable. Those are things that are critical to having a well-running organization and team. But like you guys all alluded to, is taking care of each other. We were at a point where we were sprinting for months, and at a certain point, a team member said, I have to take a week off, and it was okay, no questions asked. Go take your week off, hand over your critical tasks that have to get done. We'll find someone else to take the load, and we'll figure it out. And it's having that trust in that if you ask for help, you will receive it, but also that your employees are going to work as hard as they can. They're going to have ownership, and when they tell you something, you got to believe them. And that has helped a lot, because we really focused on culture very early, and I've made it a priority, so that even as we continue to scale rapidly, that the culture is constantly being reminded, and put in motion and practiced.
Great. All great answers. I really appreciate it. I think personally, I've sort of run out of questions for you. I want to give you an opportunity if there's more that you care to say, each of you, about your companies. And then I think we should take some questions from the chat, because I don't know if you've been paying attention to the chat, but people are saying, wow, amazing stories, inspirational panel, that kind of thing. So I'll give you about 1 minute each to, I think one of the questions that is here, the last one, is next steps. Where do you guys go from here? If you want to grab that, Eric.
Yeah, sure. No, that's actually what I was going to talk about. And I think that, one of the things, our product was in some ways funded by government money. And, what we were very conscious of is that we didn't want this to just be a product that was only worthwhile for COVID. And so thinking about that broader, what's after that. And, I think we've been very conscious and thoughtful about creating it. And we're focusing more on chronic conditions and things that we can do after COVID that can help those populations of patients. So, selfishly, that's something we want to do from a business standpoint. But I think also from a societal standpoint, we're here to make people's lives better and healthier. And so whenever we're making those decisions, we're always thinking about how do we create this to be a long-term sustainable, not only product, but working with our partners for them to have this be a program that actually is what they're doing. So we have an opportunity now with our clients to kind of expand this into what they're thinking about in the future in terms of, chronic condition management and keeping patients, anticipating patients that, may not need to go to the emergency department or to the hospital, one, because those are places where you don't necessarily want to be. It's a great place to go, but there's things that, nobody really wants to go there. But also from that cost standpoint, as, a country, we have to be thinking about that in terms of demographics and everything. So that's really, I think, what we've always thought about is what's the long term here, not just we needed to do what we needed to do in the emergency, but we also want to make sure that we're sustainable.
Great, thank you. I got two good questions so far, but I want to throw it to Aaron and then Sebastian to answer that same question, which is your next steps.
Sure. I think the obvious ones are to expand internationally. So we've gained approval in Canada and the UK, and we've started building out our supply chain to those two countries, starting in Australia as well, and then branching out to the rest of the EU, and then hopefully to Southeast Asia and Japan, Korea, etc. But also more product development, right? So we have a few products in the pipeline that are very promising, that will help grow the company and make it not just a product, but a true company. And so those are kind of the things that we have in mind, but, just building out the team as well. We have no sales team. And so we have to start building that out, because we've, been fortunate to rely on inbound leads. And now it's time to start thinking about, going outbound. And so building the team, building products, and it's pretty obvious, but and cliche maybe answer, but it's it's a cliche for a reason.
Yeah. Do you get any sleep? I mean, have you been able to?
Yeah, we've actually prioritized. So we've made it a rule that we can't work after 8, and we have to try our best to not work on the weekends. And the founders keep each other accountable on it. So actually, one of our founders had surgery about a month ago, and was working the next day. Hopped up on pain meds, trying to send emails. And I got an email from her, and stop. I'm like, I'm forbidding you from working. Like, if I see another email from you, like, I'm going to find someone to turn off your internet. So it's just
Good
keeping
for
each other
you.
accountable on our mental health and physical health. So
Great. And Sebastian, next steps. What's up?
Yeah, we're at a very pivotal moment in the history of telehealth and remote care. And at the same time, we work with public health departments that actually implemented telehealth in the 1990s through those wall-mounted video phones. And in a lot of ways, this ability to care for somebody remotely, this has already been invented. And we believe that with asynchronous videos, so we work with video recordings, we have figured out in one very critical disease state, tuberculosis, how you get people to take 95% of their medication. And we went into diabetes, into transplant, into asthma a couple years ago. And what we see is we can help patients with chronic diseases too. And now we've got that preliminary data that shows we're going to do exactly what we did in tuberculosis. We're going to do that for patients with chronic diseases. So for us, it's about taking this moment. We were always way too early. We were years early with what we did. Now we're I think we're a few months early, and it's going to get really interesting as telehealth becomes a commodity, and patients, providers, health plans realize that asynchronously, so non-live, you can reach thousands more patients than you could with live interaction.
Great, thank you. So first question, MJ, how are you? Glad you're here. Says, what was your single greatest challenge as you built and scaled your respective companies? I hate to do it, but Aaron, again, because you are a product company, you need a warehouse, you need shipping and understanding, as you said, boxes. What do you think your single greatest challenge was as you had to ramp up and meet 1 million masks a month?
Yeah, it was definitely hiring. And I think you ask any founder, what their biggest worry or challenge is, and it's usually talent. And we were fortunate in that we've been in the entrepreneurial space for close to 3 years now, where we were able to rely on referrals from others. So we had a very key, our first C-level executive that we hired that has been invaluable. And I interviewed him once, but I relied on the word of mouth of everyone that knew him, that I trusted, and said, this is a great person, and he knows what he's doing. He'll get stuff done, and it worked out. Right, so we had to just trust that whom we were hiring were right, and if we got it wrong, we had to fire them quickly, and we had to do that a few times. And so
hire fast, hire slowly, fire quickly.
Yeah, and unfortunately, we didn't have the luxury of hiring slowly, so we hired quickly, and if they didn't work out, we had to pull the trigger pretty quickly. But so far, we haven't had to do that too often. So I think just the word of mouth and the referrals and the support from the community has been instrumental in that.
Super. And I know you're currently hiring, right? On your website, do you have job postings?
Yeah, we actually filled that. We were hiring a staff accountant. We filled that last week, but we are hiring a few other positions that'll go live pretty soon.
Okay, great. So go to clearmask.com.
Yep. I think we'll post on LinkedIn as well.
Okay, great. Sebastian, how do you want to handle that one?
Yeah, well, we've been lucky. We've had great investors. We've had great NIH funding. The team is insane. I mean, not actually insane. Some of them, yes, but they're very, very intelligent, motivated, capable, skilled, and they grow so fast. Our problem, and maybe Eric is going to be able to help explain some of this. And I don't want to be a complainer. I'm just going to tell you what the challenge is, and we will overcome the challenge. But the incentives in the healthcare system are very unusual. We help patients take every dose of their medication, but and then when you take your medication, you feel better. Then you don't go to the hospital. You don't have expensive healthcare. But I'll give you a few examples where the incentives are completely misaligned. I have a CEO of a hospital tell me, when we tell them that addicted mothers we can help them take their treatments so that their newborns spend half the time in the emergency room after birth because they're born addicted. That CEO tells me, yeah, but Sebastian, we walk through the NICU, that's the neonatal intensive care unit, and we see all those babies. That's revenue. Or you have you prove that you can prevent children with asthma from showing up at the emergency room by helping them take their controller inhaler every day. But you hear that during the pandemic, the emergency room has very low volumes right now and actually may need the business. Or you have a health insurer say, Sebastian, that's great that you can help these patients take their medication. But really, the only thing we're bonused or penalized on is whether they have it in their mailbox. I just need to get it in their mailbox. I don't really care whether they take it. So anyway, no complaints. We know what we're doing. We are confident that when we secure 90-some% medication adherence across the board, patients feel better, and those outcomes are going to drive financial success. And we're proving that now. And our revenue is it's exponential growth right now. But maybe if incentives in the healthcare system can start to normalize over time and go more value-based, I think we're going to be in an even better position.
Great. Eric, you want to grab that one? The single greatest challenge as you scaled?
Yeah, no, I agree wholeheartedly with Sebastian. I think that that's one of the things with healthcare is that, not only are the incentives misaligned, I think a lot of times it's a very, and again, I'm generalizing here, but it's a very slow moving industry. So, and again, any enterprise sales type of model, it's going to take some time, but, we have situations where a year to a year and a half where from when there's interest to getting a signed contract, we're having to go through multiple layers and stakeholders. And again, I don't necessarily disagree with that because we're dealing with people's lives and we want to make sure that we have safety and that sort of thing. But I do think that, there are times and places where when there is a solution that's proven, how can we get that to patients and allow them to see the benefit of that? So, that's one of the things with the pandemic that I think did accelerate that. And so I hope that we'll see a little more, willingness to adopt some of these emerging technologies like we have on the session here today. I guess the other kind of challenge I would say for us has just really been, we've bootstrapped our company, but really just trying to keep focus on the problems that are the great problems for us as a company and that will have the highest impact for patients and caregivers. So, again, being focused on the emergency department, really the front door of the hospital and, that triage process, we're really running up against a system that's about a 20-plus-year-old system based on paper that, it's really highly reliant on the clinician that you're working with. And again, clinicians every day are doing heroic things and all of that. And I think that's where we always say our technology is meant to support the clinician's decision-making. It's not to replace it. So it's how do we really get that messaging out there? And there's a lot of hype around, machine learning, AI, trying to fight that kind of, all the promises that it's going to solve world hunger and peace and everything else. And really being realistic in where it can truly benefit the healthcare system. So I think, again, those are some of the things that are always, I'm always thinking about.
So we got another question in the chat, and I'll throw it out there. And then whichever one of you cares to answer. We'll go one at a time now because there seem to be a lot of questions coming in the chat. But Jorge says, what are you going to do if this crisis stays 2 more years? What does that do to your supply chain? What does that do in general? I think the world needs to be thinking about what are we going to do if this stays with us for 2 more years? Anybody?
Yeah.
Go ahead, Aaron.
We just started in we've actually opened up a new manufacturing plant here in the U.S. in Idaho. So we're trying to keep some of it domestic, some of it we're basically diversifying our supply chain, so that if something happens again, we're prepared. So that's definitely been something that we've been looking at, and then just bolstering our supply chain, so diversifying how we ship. During COVID, we've been chartering flights and delivering masks that way, but now we're doing ocean freight, trucking, kind of looking at a bunch of different options that are
drones.
Obviously less expensive than chartering entire flights. So yeah, and then
Great.
Sebastian, sorry.
Karen is weighing in here with an interesting question, but she's saying, do you have clinicians on your leadership teams to provide insight from the perspective of a healthcare professional? Anybody want to take that one, Eric?
Yeah, I can take that. So we do. We have a chief medical officer who's actually a practicing emergency department physician that's on our team. And then we also have some nurses that actually work with us part-time that are Hopkins nurses. And some of them, I don't want to get into HIP or anything, actually personally experienced COVID in the early stages. So, again, their insights, I think, into what we, as a company are always making sure is that whatever we're doing, we're not trying to necessarily, it's all about that user, and it's all about how that we can support them. So, one of our nurse consultants, like I said, she was on the ground floor of kind of implementing our triage tool and was actually a very opponent of it, and actually said, well, you're not going to bring in a robot here to take my job and that sort of thing. And we said, that's not what we're trying to do. And actually, she's been such a strong advocate for us that has really been an evangelist for our products, because it's really helped her. But I do think that, we rely on our own clinical folks, but I think the other piece of that is really also understanding what your clients and what their workflows are like, and where you can come in and help them. So I do think specific to us, it's very important that we are seen as a group that is clinician focused first, technology second. So that's how we always look at it.
And I know I said I was going to just one at a time, but I think it's important, Sebastian, for you to weigh in and on your team. Is there a clinician or some healthcare professional?
Yes, absolutely. So we have a software, which was intended originally for public health departments, but we then launched an engagement service for those providers who did not have the time to engage with patients as frequently as we do, which is near daily. So our engagement service is entirely clinical, and so it's a critical part of offering EMOCA as a service, a turnkey service for med adherence. Our clinical leadership comes out of Hopkins, so we spun out of Hopkins in 2014, and Dr. Bob Bollinger's team at the Center for Clinical Global Health Education at Hopkins is our clinical leadership.
Great. And Aaron, anybody clinical on your team, or do you just consult with?
Not formally on the team. We have
Okay.
a medical advisory board and then a supply chain advisory board.
Super. That's great. This is just a comment, and I don't think we have to weigh in on it, but I want to make sure everybody's aware that Sally Cherry has said, since COVID-19 may become endemic, aka it's not going away, long-term affordable preventive aids are definitely needed. So she's giving a shout out to all three of you. So thank you. And I think we've tackled this before, but if anybody, well, Rebecca has two questions here, and she said, here's a better one. How has the pandemic affected your international expansion strategy or international sales, if it has? Anybody? No?
It's actually been easier for us. We
Great.
had the UK and Canadian governments actually reached out to us to help facilitate approval in their countries. And then the hardest part was actually securing transportation. We pay cash up front to secure air freight because people are fighting for air freight, and it's a hard time to get air freight right now. So that has actually been the biggest barrier to expanding internationally.
Oh,
is
interesting.
logistics.
Yeah.
Yeah.
Wow. Okay.
I think
And go ahead.
it's harder for the software players because what happened in the pandemic is that every institution reached to their most trusted partners to deliver something fast, right? You're not going to go out and take an RFP for something you need in 2 weeks. And internationally, it's probably a very similar situation that, it's not just the US where we're innovating, everywhere is innovating. So I think that, we are launching the Emirate of Abu Dhabi next week. But other than that, it's not, it's very difficult time to penetrate a foreign market unless you've got, that one product that everybody in the world needs, Aaron. So.
This question from Andrew is very specific for Aaron. Not so much you guys, Eric and Sebastian, given the kind of work you're doing, but the dreadful FDA process to approve your mask. How was that?
It was both difficult and less difficult than I imagined. I think mostly because we had good advisors and good consultants. It took about a year, and it was a lot of laboratory testing, a huge amount of laboratory testing, a lot of paperwork, a lot of numbers, and then just one clinical trial actually, which surprised me. It was actually easier than I thought it would be in terms of the clinical trial. But I think we were just fortunate. We found a FDA consultant and an ISO 13485 certified regulatory person that actually is a founder as well for a medical device company. So he knows kind of both sides and how hard it is to be a founder, but also the FDA side. So he's been instrumental, and he's actually still our VP of regulatory, even though he's starting his own other company as well, or has started his own other company. So just going back to talent. So to directly answer, about 1 year.
Wow. But so smart to find an expert, to find someone who's been there, done that with a medical device and help you down the pathway. Very, very good.
And we were fortunate too, just because surgical masks have a guidance document from the FDA. So the FDA actually lists out what they expect in a 510K.
Nice.
We just have to follow the recipe book.
And Sebastian, FYI, because I just had a conversation with her, but your new head of the Social Innovation Lab at Hopkins did most of her career work in the Middle East, in Dubai. So if you want to expand there, go see Madison. I can make the introduction.
Great. Yes. Maddie.
Yep. Let's see. Any more questions?
I can add a little insight on the international question. So we haven't necessarily been focused on expanding aggressively internationally just because there's so much to do here. But I will say some of our clients, we do serve, some hospitals have global patient service groups that they have patients from other countries coming here. And so what we've seen from that standpoint is it's actually been a difference in some areas where there have been travel bans and things like that, less of those patients, but they've been able to actually find more patients from North America coming and that sort of thing. So we've seen some shifts in kind of the market on that side of things. So I actually was in the kind of trade organization for those groups within hospitals last week, and it was very interesting to hear about how there's been kind of a shift in the market around that. So
great. Anything else that the three of you want to cover that we haven't? You want to brag about yourself? You want to pat yourself on the back? Oh, wait, I've got one from Technically. Hi, Stephen. And shout out to Technically, because Baltimore Innovation Week wouldn't happen without them. But his question is, how do you talk about Baltimore when others ask that you're from here and what it's like? That's a great question, because you're doing such great work, but you're doing it outside of here. And as I say, you know, I'm standing in a building that before ETC moved in, we were last seen in 2003, episode 7, season 2 of The Wire. So, yeah, anybody care to grab that one?
I mean, I'm not going to make any friends with this answer, but I say it's a great place. Just the football team. I'm from Pittsburgh, so I
Now that's pretty.
but
that's not good,
no,
Eric.
No, but seriously, you know, I think we always speak obviously highly about it. I think that the you know, with some of the things you talked about, I think that's obviously people will ask about that, but you know, I think the ability to kind of have the support of others, and you know, I you know, give a shout out to you, Deb, and the ETC, and just all that you've done for us. You know, we're also involved with the Towson University incubator, and just, you know, again, just the great support, and how I feel that, you know, people do want everybody to succeed. I don't, you know, like Sebastian here, that sort of thing. I feel like everybody is trying to push things forward together rather than to cut each other down. So I just, you know, again, this event, everything, I obviously say high things about Baltimore. So.
Yeah, and you know, I always tell people that the best part of Baltimore is Smaltimore, and that you are 1 degree of separation from anyone you need to know. And so if I don't know them, you probably do. And as it turns out, Madison's right here in the chat room, and she said, reach out to me, Sebastian. So it's like that. But Aaron, what have you found about Baltimore when people ask why there?
Yeah, I think it's obvious when we talk about how we started as Hopkins students, and it helps, you know, to be frank. And I think it's just a natural kind of location for a lot of reasons. But I mean, one, we've been able to source pretty much our entire operation here in Baltimore and Maryland. It's convenient for us to go to DC. We've made day trips up to New York when we've had to. Rent is cheap. So it's a nice place to grow a team. And then, you know, obviously the Smaltimore, you know, thing that I alluded to before is it's a small but very vibrant entrepreneurial community here. And it kind of has that chip on the shoulder, and everyone wants to, you know, get rid of the stigma, I'd say, of Baltimore. And so everyone wants to help. And, you know, I couldn't say anything better. I mean, we wouldn't have been able to get to where we are without all the help from Baltimore and everyone in it. So,
yeah, my funny story is I did a lot of work in the Middle East myself, and I had a partner over there, and he's, you know, I mean, right in the middle of where all of the mayhem goes on in the Middle East. And he called me on the phone during the Freddie Gray riots and to make sure I was okay. And I was like, dude, you've got machine guns pointed at you every single day. We're okay. But Sebastian?
Yeah, I think the pandemic is a little bit of a level setter in that you can't, you know, traveling and being in person isn't as relevant, right? And hasn't been. So it doesn't really matter if you're from Baltimore or from San Francisco. People in San Francisco don't exactly like San Francisco right now. They're moving out, and they have their issues. So I don't think Baltimore's in the spotlight of problems right now. And I think that there are advantages. We also have several world-renowned institutions that are at the center of this pandemic in a lot of ways. And so I think Baltimore's in a lot of ways gotten a lot of positive attention. I've been to Pittsburgh. I don't think it's that great. I think Baltimore's a better place.
Now, Siobhan would disagree with you. She's here. Go Steelers.
Well, I think we could take a poll, and I think we could democratically decide which place is better. But yeah, it's really Deb. You know this. When we started at ETC, the startup scene was. I mean, you guys were leading that. And the companies that were startups were there. And now it seems like there are so many more.
There's so many more
So this is
places and
a real,
spaces.
real part of the economy. This is a real way that, larger companies cannot move this quickly and specialize in the types of things you're hearing from Eric and Aaron. So I think in Baltimore, we have a very vibrant community now.
I agree. And I always say that my mission is really to have an economic impact on the city of Baltimore, one entrepreneur at a time. And the three of you, again, have been in and around our programs, and you are indeed doing that. We got about 2 minutes left, but I think, I don't know. Why don't you take a bathroom break before the next session, and we'll hop out a little bit early. Okay?
All right.
Thanks, everybody. Yeah, really
Thank
appreciate
you.
it.
Thanks
you.
for your questions.
Bye.
How do we leave? Got it.